I see the waves in the hospital, but I do see people getting better. And I see these patients walking out the door and going home back to their families. When I see that, I know that there's hope. And I know that we can all heal from this.
Kristna, thank you so much for making time for us today. I guess the first question is, as a nurse working on the front lines, since I guess this hit in March, what have been your learnings?
Everyone was afraid, including myself. There was little information it was just so new that we didn't know how to treat it. Initial emotions dealing with so much death and uncertainty, being away from my family, it was really tough. As a nurse case manager, my job is to facilitate a safe discharge from the hospital, either back to their home or to the next level of care. There were days that I would come home and I just needed a shoulder to cry on, and I didn't have that. I was literally isolated by myself for a whole 7 weeks. But there was a surprisingly amount of resiliency in the hospital. We had the support of each other and my nursing colleagues. We were able to lean on each other. At first, we didn't have any masks for anybody. We didn't have that much PPE in the hospital that we were consolidating. As the hospital realized that this was worse than we thought it would be, then they started giving us masks every day. There's now been a gradual improvement in the standard of care and positive treatment plans, and that really helped build our confidence back.
There are some reports, obviously, of medical frontliners who did not make it, who succumbed to this. Did you have to experience that?
I actually had a scare at the beginning. I was tested, but I had to wait for my test results before going back to the hospital. And at the beginning of this pandemic, it was getting the results back were really frustrating. It took 9 days. So I was sitting at home, quarantined, waiting for the answers, and they did come back negative, but just that fear of getting exposed was really scary.
You've obviously seen loss, a lot of loss of lives mostly. What has that taught you?
It really taught me how to appreciate life and enjoy what we have. It made me realize that tomorrow's never promised. I should be appreciative of what's in front of me. I couldn't really be with my family, so my neighbors, they became my family.
You said that the level of care, the treatment has slowly gotten better as we have found out more and discovered more about the virus. So your concerns then are different from your concerns now. What are those differences?
When the pandemic first hit, I believe that the shutdown was very much needed to flatten the curve. When I hear the word flatten the curve, I define that as giving the hospitals a chance to catch up on COVID education and think of the treatment plans. And when there's less patients in the hospital, then there's more time to focus on how to treat those individuals and save those lives. But once there's a surge and a shortage of ICU beds, that's when we're in panic mode and the patients don't get the proper care. But I do believe that our hospital was able to do that thanks to those who complied to the stay-at-home orders within our community. My new worries now are not related to my job at the hospital, as I do sincerely believe that the standard of care has improved. But my worries are now more related to the emotional and developmental impact that the pandemic is having on my family and my neighbors, my community. Small businesses are being affected. People are still unemployed. Most importantly, I worry about the mental health of my children and how the social distancing away from their friends and the school has affected their well-being.
So you're also a mom who have been separated from your young children because of this?
Yeah, at the beginning of everything, we had separated for about the first 7 weeks. I was going in and out of the hospital and coming home, and we just didn't want to risk spreading the disease, or it was just a very scary time in our life. But now we're separated again, not because out of fear, but because schools are not back on campus, and they are now online. And because I'm an essential worker, I'm obligated to go into the hospital. My husband, he works from home, but there's just no way that he can be working at home and being a homeschool teacher at the same time. We're apart, and we won't be able to see each other until schools get back on campus.
If you knew then what you know now about this, would you still go through it? Would you still choose to be a nurse?
Definitely. I feel that being a nurse and being part of this pandemic is life-changing. It's just really made me feel like this is what I'm supposed to do. This was definitely my calling.
People laud you, rightfully so, all essential workers, especially medical frontliners, as heroes, right? But for you, as an essential worker, as a medical frontliner, who are your heroes?
I think everyone who is complying and helping and being respectful to others and being kind to one another, those people in our community, they're our heroes. I honestly don't feel like I'm a hero. I feel like I'm just helping those who are vulnerable and in the hospital. But I really want everyone to know that everyone can make a contribution to fighting this problem, and we can all be heroes.
For someone like you who's there, who sees, how bad is it really from your perspective?
I think the media focuses a lot more on the people that are dying, but people are also getting better. I feel that there is hope. I see the treatment plans working, and I see these patients walking out the door and going home back to their families. So when I see that, I know that there's hope, and I know that we can all heal from this.
I know this whole interview is such a message in itself, a powerful message of hope and positivity, but if there's anything else you'd like to close this interview out with, what would that message be?
I do feel that we can open the community and reduce the risk of infection if we respectfully wear a mask and practice proper hand hygiene. If you have any underlying health conditions, definitely be extra cautious. But I don't think it's reasonable to expect everyone, the entire population, to continue to stay at home, especially for the well-being of our mental health. I think we can all be responsible, respectful, and kind to each other.
As you can see, we're trying to change gears right now. For many weeks in the past, we have focused on the sacrifices of our frontliners, the lack of PPE, some of the struggles, the isolation, the fear. And while those are still present in some, we'd like to focus on and highlight the stories of inspiration and stories of hope. And that is what Kristna has also requested us to do as we change gears, talking about the improving care, standard of care for COVID patients, and how a lot of people are also walking away and beating COVID. And that's something that I think we need to highlight in order to give us hope that we can survive this, especially if we stay stronger together. And speaking of changing gears, Toyota is also helping us do just that. A lot of people are still maybe traveling, maybe you haven't been able to take your vacation yet before fall starts, or maybe you want to travel and see the beautiful fall colors all over the US. The safest way to travel these days is by car. And for those who are in the market for a new car, now at Toyota's, we make it easy sales event. Get great deals like low payment leases and special financing on a bold new Camry. With its exceptional handling, offers end soon. So hurry into your Toyota dealer or visit buyatoyota.com. We make it easy.